A newborn. Prior to touching this newborn, I'm going to wash my hands and sanitize first. I'll begin with abdominal inspection. Okay, so the baby's abdomen appears to be protuberant. I can see that the umbilical cord is clean and dry. There is no redness, swelling, nor herniation of the umbilical cord. I'll proceed with auscultation. So, this abdomen has normal tinkling sounds without increase in pitch nor frequency. I'm going to do the percussion. So for ease, I'm going to move this baby here. Okay. So there is tympany in all four quadrants of this abdomen. I'm going to try to palpate for the liver edge and the liver dome. So for the liver edge, then I'm going to mark it here. Then for the liver dome, here, and then measure the liver span. Next, I'm also going to percuss for the splenic dullness. Okay. Next, I'm going to palpate the left epigastric area. I'm going to do palpation. So let's relax the baby first and do palpation. So I did not feel any mass nor elicited any signs of tenderness. Try to palpate for the liver edge. So the liver edge is here. That's around 2 centimeters below the right costal margin. I'm also going to palpate for the spleen. So the spleen is here, approximately 2 centimeters below the left costal margin. You can also try to palpate for the kidney. Okay. Next, I'm going to assess the spine. I'm going to turn this baby over. So the spine appears to be midline. I do not see any pigmented spots, hairy patches, nor pits. And I'm going to palpate. So again, the spine appears to be really midline on palpation, and I was not able to palpate for any abnormalities on the spine. Next, I'm going to do the 4 reflexes. First is the palmar grasp reflex. So by placing my hand here, there is intact palmar grasp reflex because the baby grasped my finger. Then we have the plantar grasp reflex. So by stroking the base of the toes, the baby has intact plantar grasp reflex because the toes curled. Going to do the rooting reflex, so stroking the right corner of the mouth. There is intact rooting reflex because the baby turned her head on the direction where I'm stroking, which is on the right, and started sucking. Then for the molar reflex, I'm going to hold the baby, stabilize her first, raise her up approximately 2 feet, and then drop her like this. So there is intact molar reflex because the arms of the baby abducted and then extended. Then the hands open and the legs are flexed. Next, I'm going to do the ortolani test. So let's flex the thigh at the hips and flex also the knees. Then I'm going to position my hand and then abduct. So I was not able to feel any claw sensation during this maneuver and no click was heard. So there is no hip dislocation as per the ortolani test. For the Barlow test, so again, I'm going to flex the thigh at the hips and also the knees are flexed. And position my hand again. And this time, I'm going to adduct. So by adducting, there is no plunk sensation during this maneuver and also no click was heard. I can say that there is no hip dislocation as per Barlow test. So there is a stable hip. So this ends my return demo. Thank you so much. And I'm also going to sanitize again. Thank you.